Hi everyone, let's address this question today: how to think critically. Honestly, it's the number one skill that separates those who pass the NCLEX exam and those who fail. So let's break this down step by step. Remember, the first thing is, what is critical thinking? Critical thinking is not about knowing everything, it's about analyzing, prioritizing, and eliminating the wrong answers logically, even if you're not 100% sure about the right answer. So, how we can do this? Let's go step by step. Step 1: read the question like a detective. Before even looking at the options, underline the keywords always. See some words like first, best, priority, identify the topic. Is this a safety or a priority or teaching question or intervention question, right? Rephrase in your own words if you can. What exactly the question is asking you to do. For example, the nurse should first assess this means what? Priority. ABC or life threatening comes first, right? Step 2: use the golden NCLEX framework always. And here are the 4 tools which can help you that to use for your critical thinking, right? So number one, as everyone know, ABC: airway, breathing, and circulation. Always choose airway issues first, like cyanosis, choking, respiratory distress, then breathing, like low to said SOB, then circulation, like bleeding, shock, right? And the next one is safety first. Will this action prevent the harm? Always protect the client from immediate harm before comfort or teaching. Next one, acute versus chronic. Acute like sudden, new, severe, unstable, and the chronic like long term, stable, and expected. The next one, stable versus unstable. Unstable clients, new symptoms, changing vital signs, or stable clients like expected findings, predicted outcomes, those ones. Once you know them, then look at step number 3, like eliminate wrong options. So smart way. This is where critical thinking truly happens now. Now here's you can how you can do knock out the wrong answers pretty easily. So the first eliminate method is nice but not necessary. If the option is helpful but not like a life saving, this is not your priority. Like offer emotional support versus give oxygen to cyanotic newborn. Oxygen first. Emotional support can wait here. Now, second thing in eliminate options is eliminate those options which can delay the action. If the patient is in danger and an option says notify provider or document, not first. Act first to stabilize and then call someone for help. Number 3 in elimination, eliminate irrelevant information. So some options are correct facts but don't address the question, what actually the question is asking. For example, client anxious and pacing, not a life threatening. Blue lips, airway emergency, yep, that could be the right answer here instead. Number 4 in elimination, be aware of some absolute words like always, never, all, none, you must, you should. They're often incorrect answers in your exam. Number 5, choose the most direct action. When 2 answers are correct, choose the one that act immediately on the problem rather than just talking about it, right? Now, here's how you can do the critical thinking mindset. Repeat these words always in your head when you're looking into the question. Who will die first if I don't go now? Which finding is expected or unexpected or abnormal? Which option solves the root problem, not just the symptom? What is the most safety focused action, right? This is something we need to look. Now, here's a bonus tip for you. Flip the question around. Sometimes it helps to turn the question, into true false test for each option, but instead, sometimes you can also ask yourself, if I do this first, is anyone going to get the worst if I don't go in there? Will this solve the problem or the real problem, or is this just the distracting me this answer? If the answer is no, or it doesn't help the main issue, eliminate it right away, right? Now, The final tips, what I can say from my side, which I think is required to pass the NCLEX exam: slow down. First thing is slow down. Rushing is the enemy of critical thinking. Number two, talk to yourself through each option louder, even if it's in your head, maybe sometimes. Practice some why questions, like why is this option is wrong, why is this the more right answer, when you're practicing at home before you go for actual test. Train your mind daily. Do at least 10 to 20 questions in a day, and always review those questions with the detailed rationals as well. Now remember, as I said, critical thinking is a skill, not a talent. It develops every day with the practice. So if you train your brain to use these steps, the one which I mentioned earlier, you will start to see questions differently and answer them faster and more confidently. Thanks for watching the video.